I am Dr. Blake Conklin, and I'm a physician with Lawrence General Surgery. I chose to go into general surgery really because of the variety that we see. You maintain a very strong connection not only to surgery but also to medicine. We're trained extensively in critical care, intensive care management with ventilators and different tubes and lines that are placed. And so I feel like we have a very broad skill set to be able to offer our patients very quality care. My philosophy of care is a patient-centered, patient empowerment model. I think as physicians, we need to remember that we're not there to tell people this is what you're going to do. You're there to listen to the patients and to provide them with the medical or surgical information to make the decision that's best for them and their family. Sometimes that's surgery and sometimes that's not surgery. Sometimes that's optimizing, medical conditions because they're too high risk to undergo that operation at that time. And we're going to modify those and we're going to optimize those to get you to a point where I'm putting you in the best place possible for minimal complications. And so I think we need to remember that, and I educate patients all the time. As oftentimes as they feel like they're not driving the boat, I remind them that you are driving the boat and that hopefully the information you gain today, you, your family, and myself will be able to compile an individualized care plan for you or your family member, whatever that may be. So I think for me, anytime that patient's in my office, I always try to picture what if my family member was sitting in that chair, what would I want for them? Like I said, that may be a surgery, that may be no surgery. But I want them to understand that I do honestly treat my patients in that regard. And so they're always in the best of hands, and every time that I step into that operating room, I strive for perfection. The best advice I can give to patients is come prepared to your visits. Have questions laid out, and sometimes that means writing them down. When you're in your visit with a physician, oftentimes your mind is going in 20 different directions depending on what kind of diagnosis you're dealing with. And bringing a friend or a family member with you is also highly advisable because they can sit there and take notes and maybe reinforce some of the questions you had beforehand, and you can really focus on that interaction with the doctor and making sure that you're getting the information you need to make that decision moving forward. Here at LMH Health, I think they've done a phenomenal job of recruiting and bringing back medical providers, medical and surgical specialists that are very highly trained, many of which have strong ties to the surrounding community. We have state-of-the-art technology. As I stated, these two just phenomenal robotic Da Vinci surgical systems that allow us to operate at the top of our game. And I think if you have the capability and the opportunity to seek out these medical advancements in your own backyard, it takes the added stress off of some sort of a travel in your care. And so if you can go get that procedure done or some sort of surgical intervention done, and then you can go home immediately after that and you can recover in your own bed with your family at your house, there's really no substitute for that.